Hello everyone and welcome to Star Health Insurance YouTube channel. Hi, I am Dr. Jayadatt Pawar, your robotic and bariatric surgeon. Today in this video, we are going to talk about something which is one of the most searched diseases on the internet, hernia. In this video, we will be talking about what exactly is hernia, what are the types of hernia, how to know whether you have hernia or not, are hernias dangerous, what are the treatment procedures meant for hernia. So let's come to see what is a hernia. A hernia is a protrusion in which one of the organs pushes through the muscle or tissue that contains it. So the organ exists through the wall of the muscle or tissue that is surrounding it. Hernias normally occur in the abdominal muscles, but it can occur anywhere in the chest and groin. So let's know how you will know whether you have a hernia or not. These are the most important signs. That is, there's a bulge in your abdomen or groin. The first sign of a hernia is the bulge created by the tissue or organ. And usually you might notice it when there is an increase in pressure, when you're coughing or you're trying to lift something heavy or you're standing up or you're straining. So the patient will also have some kind of soreness or pain, and these bulges are typically associated with mild discomfort that can be exaggerated again during straining or any strenuous physical activity. Sometimes patient may even feel nauseating, or some patients might even have symptoms of constipation. So some people ask us in OPD whether the hernias are dangerous. Do I need to get the treatment right away? So usually inguinal hernias start off as an initial bulge that occurs when the bulge eventually gets larger over time. In some cases, an inguinal hernia may progress to incarcerated hernia, where the protruding bowel becomes trapped and still has a healthy blood supply. However, if the blood supply to this trapped part of the intestine or bowel gets cut off, this tissue will become gangrenous. Now, this is what we call a strangulated hernia, and this is a medical emergency. That is, you will need an emergency surgery. So another question which we frequently come across is, do inguinal hernias always need to be treated? Well, inguinal hernias do not get better on their own. In fact, they become larger as the time progresses. And there's only surgery through which these hernias can be treated, since no proven medical treatment is available currently. If your inguinal hernia is causing you pain or discomfort, you may choose to have your surgery now. Your doctor will discuss the risks and benefits of the surgery with you so that you can make an informed decision. The chances of complications after hernia repair surgery are lower if the surgery is elective rather than having an emergency urgent surgery. So what are the types of surgeries normally we do in case of a hernia? That is a keyhole surgery, which are the least recent advances, that is laparoscopic and robotic. Both these techniques are used to place the protruding tissue back into your abdomen and repair the weakness in your abdominal wall. The weakness in the abdominal wall is usually repaired by sewing in a piece of a flat mesh to help strengthen the muscle wall. So another frequently asked question in the OPD is the mesh used in hernia repair surgery is safe? Well, the use of mesh in hernia repair surgery is recommended and is also safe based on the current data and evidence. In these cases, the mesh is placed flat against the weakness in the abdominal wall to repair it and help reinforce the abdominal wall. There is also option for an open surgery. However, with time, the keyhole surgeries have progressed well, hence they are being used more often now. How long does it take to recover from inguinal repair surgery? Inguinal hernia repair surgery is usually a day care surgery, so you can return home on the same day as your surgery. However, you will need to avoid some strenuous activity for at least 4 to 6 weeks. At around 6 to 8 weeks after hernia repair surgery, you can gradually introduce weight-bearing activities. Recovery from keyhole inguinal repair surgery is usually faster. You may be able to drive after a week. Another apprehension shown by patients is, can inguinal hernia come back after treatment? Well, yes, inguinal hernias can come back after treatment. Although hernia repair surgery is effective, your abdominal wall is still not going to be as strong as it is before your inguinal hernia developed. However, modern surgeries do reduce the risk of recurrence. Another question is, how can I reduce my risk of developing another inguinal hernia? Well, you can reduce the risk of your inguinal hernia recurrence by quitting smoking, losing any excess weight, and maintaining a healthy diet. Following a healthy diet which is rich in fiber and staying active is to avoid constipation. Make sure to take any prescribed medication to treat conditions that can increase the risk of your inguinal hernia, for example, medication for prostate hyperplasia. So that's it for today. If you found this video informative, don't forget to like, share, comment, and subscribe to the Star Health Insurance YouTube channel for more healthcare insights. See you next time.